My name is Brett Thompson, and this is my presentation on the implementation of safe consumption sites. Safe consumption sites are sanctuaries where people who inject drugs can have their drugs administered by a healthcare professional and have resources necessary to treat an overdose if it should occur. These sites are designed to respond to intravenous drug use epidemics in various countries and reduce the number and effects of overdoses and other drug-related harms on individuals. Safe injection sites should be implemented to combat intravenous drug epidemics because they promote the proper use and disposal of syringes, reduce overdoses and drug-related deaths, and provide a sanctuary for people who inject drugs that removes them from harmful environments. In regards to the proper disposal of used syringes, a large public concern of injection drugs use and safe consumption sites is the improper disposal of used syringes in parks, streets, and other public areas where children play. Parents and other concerned persons believe that the implementation of safe injection sites incentivizes injection drug users to live in these local to these sites, and increases the number of improperly disposed used syringes. Safe consumption sites decrease the number of improperly disposed syringes well below the number of syringes that are improperly disposed in areas with an absence of such sites. There have been numerous studies on this topic indicating a positive effect, but in reference to one, a safe injection facility in Spain reported that individuals who used these facilities were 6 times more likely to dispose of their syringes properly than those who did not. Furthermore, 96% of individuals who injected drugs without use of a safe consumption site in the past and did not properly dispose of their syringes say that they are now properly disposing. They use proper disposing practices always after adopting the use of such a facility. This evidence is an indication that safe injection sites serve not only individuals who inject drugs, but improve the health and safety of the community as a whole. A major concern of implementing safe consumption sites is that it enables drug-addicted individuals and actually contributes to the issue of addiction instead of treating it. This notion was combated in a 2022 study that examined the effectiveness of safe injection sites that offered overdose prevention services in Vancouver, BC, in areas highly concentrated with drug-addicted individuals. This study found that 12 months after implementing a safe injection site, required paramedic presence at overdose scenes were reduced by 23.5%, and emergency room visits decreased by 1.25 fewer events per 100,000 population. The discussion section of the study indicates that over 69% of fatal overdoses occur when the deceased was alone. This indicates that the stigma of safe injection sites is harmful to drug-addicted individuals, and more fatal overdoses could be prevented by encouraging the drug-addicted to utilize these services. Another benefit of safe injection facilities is the provision of safe sanctuaries for injection drug-addicted individuals. These sanctuaries provide drug addicts with the benefits of reducing the adverse effects of inclement weather, risk of overdoses, protection from street violence, and reprieve from fear of arrest. By removing individuals who are drug addicted from the harsh environments in which they are at risk of harm, the chances of treatment and recovery are greater to reintroduce these individuals as functional members of society. In conclusion, safe consumption sites should be implemented in areas with detrimental intravenous drug use issues to promote the safe disposal of syringes, reduce the number of and effects of overdoses, and to provide individuals with a sanctuary apart from their typical harsh environment. So far, there have been 200 safe injection sites established that operate in 12 different countries. Beneficially, that number is increasing and will hopefully increase in the years to come for the betterment of drug-addicted individuals and society as a whole. Thank you very much.